Hi, my name is Chloe and I'm going to be giving you some top tips to help keep your child's teeth healthy from the ages of 1 to 2 years. It's likely that your child has started to go through the teething stage. This can continue until all 20 of their baby set of teeth have come through. This will roughly be by the age of 3 or 4. You should be aware of the signs and symptoms by this stage and can continue to use special gels along with any pain relief that is safe for your child to use. You can always use teething rings and toys which may help your child. All teething pains vary, so always speak to your dental team or doctor if you have any concerns. It's advisable to avoid using a dummy or a soother and discourage thumb sucking after your child's first birthday. These can all lead to problems in how the teeth develop and grow and may result in your child needing treatment as they become older. We encourage you to start brushing your child's teeth as soon as their first tooth appears, at least twice a day, once before bed and at least one other time in the day. It is advisable that after brushing before bed that your child does not have any other food or drinks other than water, as this can lead to dental decay. We advise brushing your child's teeth with a flat smear of toothpaste containing 1000 parts per million fluoride. We recommend this up until the age of 3 years old. To find the fluoride levels, look on the side of the toothpaste box and make sure you use a toothbrush with a small head. Adult size is too big for those little mouths. You can use an electric toothbrush if you like, but a manual brush can be just as good with a correct technique. It is important to brush each surface of your child's tooth as thoroughly as you can, ideally for 2 minutes. Following the diagram on the screen, focus on these 4 areas. Number 1. Outside, place the brush at an angle along the outer gum line. Brush gently in circles and repeat for each tooth. 2. Inside, repeating technique on step 1, brush the inside surface of each tooth. 3. At the back of the mouth, brush the chewing surface of each tooth. And 4. Behind the front teeth, use tip of the toothbrush to brush behind each front tooth, both top and bottom. We know this can sometimes be a battle, so feel free to find creative ways to keep your child entertained, either by your child's favourite video or song. Some brushes come with flashing timers or a sound timer to show them the length of time they should be brushing their teeth. There is an app called the Brush DJ that provides a 2-minute timer to music. This app also has short videos showing how to brush your child's teeth. Some of your child's favourite cartoons may have a dental episode for them to watch. Diet is important when it comes to your teeth. From 12 months, babies should be having a well-balanced diet and have been introduced to a range of foods with a low intake of sugar. By 12 months, your baby should be drinking from an open or free-flow cup, and bottles are discouraged as they are linked to tooth decay in young children. Ideally, sugary foods should be kept to a minimum or given straight after a meal, as this minimises the number of sugar attacks on your child's teeth. Group eating is better for your teeth than snacking. For example, it's better to have your meal with a juice and a pudding in one sitting rather than spacing these out over the day. Every time we eat, the bacteria in our mouths turns the sugar into acid, and this attacks your child's teeth and causes decay. Avoid sugar between meals where possible or try sugar-free alternatives. When shopping to find healthier and reduced sugar food and drinks for your child, the NHS Food Scanner app is a great tool to use. This helps to identify these for you rather than you spending more time in the shops reading all the packaging. There is also a traffic light system on packaging for food and drink that makes it easy to identify high sugar food and drinks. There is no guideline sugar limit for children under the age of 4, but it is recommended they avoid sugar-sweetened drinks and food with sugar added to it. Between meal times and the hour before bed, children should only drink plain milk or water, and when using medicines, always ask for sugar-free. Here is a sugar board with a few examples of food and drinks you would typically give your child as a treat at this age, and a rough estimate of the value of sugar they hold. 4 grams of sugar equates to 1 cube. Aim to register your baby with a dentist and visit them as soon as your baby's first tooth appears, or at least before their first birthday. We know it can be quite difficult to find a dentist, but make sure you are on as many waiting lists as possible, and you will be contacted when your child reaches the top of the list. For help to find a dentist, Dental Choices is a website designed to make it easier for you to find and register with an NHS dentist. If your child is having pain, problems or suffered trauma with their teeth, contact dentalchoices.org or NHS 111 for help and advice. Once you are registered with a dentist, make sure you attend for regular visits. It's free for children up until they are 18 years old, and it's a good habit to get them into from a young age.
So let's remember, number 1, brush their teeth twice a day. 2, register with a dentist and visit every 6 months. 3, avoid sugar between meals where possible. And 4, avoid dummies and bottles after your child's first birthday.
Please don't forget to share this information with your family and friends. That is everything from me today, and I hope this video has helped you by providing some top tips to look after your child's teeth.